Welcome everyone. Thank you for joining us for today's webinar. My name is Myra Chen and I'm your host for today's eLotus webinar. eLotus is the leading provider of continuing education for acupuncturists. You are probably wondering, who is this new person? I am the niece of Dr. John and Tina Chen and I have just enrolled in a TCM school this year. I hope to enrich myself with the knowledge and wisdom of our ancestors and also the great doctors of today so I can carry on the torch and continue to spread the pearls of Chinese medicine worldwide. You are probably also wondering, where is Donna? Well, she is right over there training me. Hi, Donna. Aside from my family, she is my biggest mentor, and I am very fortunate and grateful to have her coaching me today and to be your MC and host for this event. This is my first weekday seminar, so if I goof up, please excuse me. Today's webinar is Painless and Effective Abdominal Acupuncture for Chronic Pain, presented by Aaron Zizov. Before we begin, let's do a little housekeeping. Today's webinar will be from 9 a.m. to 1 p.m. Pacific Time, and we will have one break. If you have not already, please get your copy of the lecture notes from the blue course access page in your account. If you'd like to join the chat, please do the following right now. Set your chat preference to everyone so that everyone can see what you're typing. You'll have to do this manually because the default setting allows only the speaker and staff to see what you're writing. If you have any questions during the presentation, please type them into the question box in your Zoom control panel. Our speaker will answer the questions as time allows. The quiz and the video replay will both be available tomorrow, and you will receive an email notification when they are. If you are interested in abdominal acupuncture and feel like you would like to learn more about it, we do have two other speakers, Paul Ryan and Dave Shipsey, who gave full-day courses and now are available as video. Feel free to check out the website and search for these two speakers, and their abdominal acupuncture courses should show up. Again, the speakers' names are Paul Ryan and Dave Shipsey. Our speaker today is Aaron Zizov, who completed his graduate studies in acupuncture, herbal medicine, and shiatsu in 2004 from Medicine College in Tel Aviv, Israel. Aaron specializes in gynecology and Chinese cosmetology and has taught at leading colleges in Israel. He has taught with us the topics of Chinese cosmetology, tongue diagnosis, and Chinese astrology, and you can find these courses at elotus.org. I'll share the link with you once I get back to my computer. We are honored to have Aaron joining us today, all the way from Tel Aviv. So let's go ahead and give him a big welcome. Aaron, will you please take over now and share your PowerPoint?
Yes, thank you very much and welcome. It's good to see and nice to see new faces. So have good luck in your new position. And hi all, hi everybody. I'm honored to be here and excited to be here once again. Thank you to eLotus, Donna, and all the staff, Sam, Rina. And I'm happy and excited to do this seminar today. I will share, we'll just do the sharing, and let me just make sure it works. And okay. Yeah, I believe it's the presentation now. And okay, so to all of you, I see more than 90 participants. Honored to share with you this information today, this knowledge about the abdominal acupuncture. I will start with just a little description of what we're going to talk about in the next like 4 hours. And so I will start with introducing this method, how I studied it, where I studied it, and the method itself, how it works, all the advantages, the mechanism, the indications, contraindications, treatment and techniques, expected results from these treatments, the abdominal meridians. I will introduce them in a kind of visual and I hope easy way to remember, to understand them. The abdominal turtle, which is the whole idea of this method, and the abdominal Ba Gua. There's like three different ways according to the different levels that we can work on the abdomen. And at the end, I will give some protocols and some case studies with the photographs of the different treatments that I used. So in case you have any question, I will check the chat box once in a while. And we're gonna have a break in like 2 hours. We'll see exactly where we'll stand, but approximately in 2 hours, which means 11 a.m. For me, it's 7 p.m. now in Tel Aviv. But for you, for most of you, from what I've seen, it's like morning. So 11 p.m. On Pacific time. We're gonna have a break of like, I believe like 15 minutes and so. And anyway, questions in the chat box, and we are starting right now. So first of all, the abdominal acupuncture, or called also the Fujian, it's the turtle system, known as the turtle system. It was developed and kind of invented by Professor Bo Zhiyun. I didn't meet him in person, but the teacher I was studying with is Dr. Xuan Lihua from the Zhejiang Provincial Hospital in China. So I was there in 2008 in that hospital for a few months. I met her there, Dr. Xuan, and 10 years after, in 2018, she came to Israel to give like a lecture, and I met her again. So you can see here, she's sitting in the clinic in China, in the hospital actually, where we used to see her patients, something like, I think 450 to 500 patients a day. And at the beginning, it looked to us as something like this. Me and my wife, we studied there. We didn't understand what we see. We didn't have a proper class those days because there were not so many students those days in China because it was after the Olympic Games. So only some foreigners were allowed to get into China. So we were lucky to be there. Like at the beginning, we were the only students from abroad or like participants. So this is how we saw the treatments, and we really didn't understand what she's doing. So I have all my writings on my notebook, some approximate points and some, I believe this is CV12, CV10, but I didn't really understand the connection of these points. So anyway, this method is, so at the beginning, this is how we looked at that. After 2 or 3 weeks, we got a proper class understanding this method. And since then, it was really like very, very, very interesting to see. And after that, to practice too. So this method was developed. It's quite new method for new in terms of Chinese medicine. It's like only 40 years. It was under the development of Dr. Professor Bo, after like 20 years of research. And it's based on, of course, ancient knowledge with classical diagnosis and treatment based on the abdomen from different positions, different areas. Later on, I will talk about also the Ba Gua and how it's connected too. But I think since then it's developing more and more, and there's lots of practice, and it's kind of very appreciated by many, even Chinese doctors, I will say. It's very effective, and therefore, I really recommend it. So anyway, Professor Bo discovered that there are different levels of the abdominal tissues. There's the prenatal system, which is through the umbilicus cord, where we get, when we are babies in the womb, we get all what we need through the umbilicus cord. And this is like the prenatal system that still exists there. And the postnatal system is demonstrating that even after, like the postnatal energy, after we are born, the area around the navel is still active, very active, and actually continues to stimulate qi and blood, or circulate qi and blood to all over the body with this model of understanding. So every level is positioned in a different layer or different level in the abdomen, when the area, the main area, or the center of all the system is the CV8 or REN8. Okay, I call it CV, but it's like REN-MY, but CV is conception vessel. Okay, so if you're gonna hear me during this lecture saying CV, so that's the meaning of that. Okay, conception vessel. So this is like the original map where we can see the different areas. So it's kind of blurred, I know, but I have different ways to demonstrate it later on. But this is how I studied it. There were no books those days. Even today, I'm not sure there's many books on this method. Maybe I'll write one day. But anyway, there's like the understanding by the different meridians here in the picture in the center, meridians that go through the abdomen. We have REN-MY, we have kidney, we have stomach, spleen, liver, gallbladder. And we have the turtle shape on the abdomen. Again, later on I will explain it deeply. And we have the Ba Gua placed on the abdomen with all what it represents. And this method, we can say that before the advantages even, the theory is basically a somatotopic system, same as we can say, as we can see on the scalp or on the eye, as not only diagnosis, but also treatment. Of course, we can diagnose in every single area in the body. Okay, next week, by the way, I have a lecture about sujok, like the Korean acupuncture, which is all the body is in the hand and in the leg, like palm and feet. So it's another somatotopic system. So besides diagnosis, we can also treat on different levels and on different parts or different organ systems, different meridians through specific zones. So we can say we have the scalp acupuncture, if it's the Chinese one, or if it's the Japanese of Yamamoto. We have the ear, we have the tongue as diagnosis, we have the face, we have the abdomen, obviously, we have hand, hand, feet, we have front mu and back shoe points. Basically, we have many methods. And this brings me to the advantages of that. So as a somatotopic system, we can treat distanced area in the body. It means that, and for me, actually, it's very easy in practice, that patients don't really need to take all the clothes off, and in order to get to a specific point. It's comfortable for me, it's comfortable for them. It's painless. There's no need in getting a sensation of qi, like dead qi. And for patients who are basically afraid of acupuncture, afraid of the needling, afraid of the pain, they don't really feel. It's again, this system is the method of acupuncture. I will explain also later, but the method is superficial puncturing, and we don't need to get to the muscles, basically. So it's all on the layer of the skin or the fat layer under the skin, but just above the muscle. And it's very important in cases that we want to treat patients who are not able to suffer in a way from this treatment. Now, it's also very safe because of these levels. We don't hurt any important areas, or we are not close to veins like I don't know, lung 9 or or pericard 7, 6, when we are close to the nerve even, and it might be painful. It's not the Jing-Well points, which are very, very effective and very strong in their effect, but they are painful, very painful. So it's safe, we can't make any damage, and it's very important also with that. It's fast. It's fast with the results that we get. When a patient lays on the bed, I will expect to get a change immediately. It might be immediately or maybe after the treatment, but until the next treatment, I must see any kind of change in the effect. And again, I will talk about this also later. It's easy to use for all ages. I don't really treat babies or little children, but I think from the age of maybe 6 or even 10 for sure, till old age, like I have patients above 85, 80, even 90 years old, and it's very easy for them to get this kind of treatment because they just need to lay on the back. It's easy. Everyone can do that. I mean, most of the patients can do that. I have some patients who are not able to do that and they need to sit because of pain issues. But basically, it's easy to use. They don't need to lay on the abdomen. Many old people or people with the pain issues, they're not able to lay on the abdomen. Like for me to treat the back might be a bit difficult sometimes. And also, we don't need any other areas in the body. I mean, again, we can combine regular treatment on the meridians, but it's not always necessary, I will say. So they don't even need to take the shoes off, okay? So it's very easy for them, very easy for me, very fast. I have days in my practice where I see 40 patients in like 6 or 7 hours. I work on few rooms and sometimes 5 or 6 rooms even, as much as I get in the clinic. And for me, it's very easy, it's very fast. I don't need, and again, when you get the system, when you understand how to do it, it's very fast. When you take the measures or the measurements of the point location, it's very easy, very fast. When the patient lays on the back, you can, if it's a shoulder pain, okay, and there's the difficulty to lift the hand up. So when the patient lays on the back, okay, so easy. I check before, okay, lift your hand up. And if it's till here, okay, then I puncture. I do the point which is connected to the shoulder. And then I ask the patient again, okay, lift the hand. And then, okay, wow, it goes upper. If not, I need to check again what to do and how to do, okay? And it's also innovative. It's like there are new extra points on the abdomen, which are not on the classical points of the meridians. And also, again, any new method is accepted by us, and we are happy to gain new knowledge also in Chinese medicine, which is so ancient and has lots of history, thousands of years of practice. So all this together gives us many advantages. The mechanism is based on the treatment of basically the mother system of all the meridians, like Shen Chui CV8, which works through, or like affects through the umbilicus cord, that nourishes all the body, or the little baby in the womb. Again, as I mentioned, it continues to circulate the qi and the blood to all the other areas in the body. And it's like the area is active, it's very active, and there's kind of energetic sensitivity there that continues to spread the qi and blood, where again, CV8 is the center of all the system, of all the method. We don't puncture CV8. We can work with the moxa. In China, they put usually moxa over salt or over above ginger. There are all kinds of like a little cake of herbs that they make, and they put it on the area of the abdomen, or mostly around the navel, and in this way there's kind of again heat and all the indications from the herbs, or all the energy of the herbs that goes through this system to all over the place. So again, superficial acupuncture in 3 levels, which means in this one, I will explain it later. Yeah, next one. So the indications, I use it mostly for all kinds of pain. If it's joints, if it's the spine, if it's like specific areas, it's very easy for us to work all over the body, on all the body. And I have cases where I treat headaches or migraines with neck problems and lower back pain together. Okay, for me, it's just to put a few more needles, and I don't need again to go to all the meridians in the body. It just works locally on that specific area, and again, it works amazingly. I see, again, the indications, the main indications by Professor Bo is that it works better for chronic conditions. But I must admit that I see that it works also in acute conditions very well. It's better for weak patients because, again, through the abdomen, we can work on the deepest levels of also the postnatal energy, working on the levels of the 5 elements of the yin and yang, or working on strengthening or tonifying the postnatal qi with the connection to the pre-heaven qi of the patient. Conditions of stroke, there's a better function and circulation for the brain through this method after treatments that don't improve by TCM. So usually when a patient comes to me for the first time, I will do the protocols which I know that works. Okay, any kind of case, I don't know, doesn't matter. I will check the tongue, I will check the pulse, I will look, I will feel, I will palpate different areas or meridians according to the main complaint. And so, for example, if it's lower back pain, okay, lower back pain, it's on the bladder meridian, so I can work on the bladder. If I work traditional TCM, I can work on kidney if I want to balance, or I can work on lung if I want to, again, work with balance method. I have many ways to work, to check and to work, and usually I have my basic protocols which I use, and I expect a change. Even again, if you work with the balance method, Dr. Tan, Master Dong, scalp acupuncture, anything that you work with, I will mostly I will prefer on the first few, maybe 2-3 treatments, not to treat locally on the area of the problem. And the reason is that I want to see something changes. The beginning of the treatment is very important for getting the patient's trust. So patients who are, patient that heard about acupuncture, that it works for this, for that, they come with expectations, and they come when they suffer. Most of the patients come when they feel bad, not when they feel good. Okay, after they do kind of a few treatments or a few series of treatments, they will understand the benefits of maintenance and prevention, and they will keep coming on I don't know, once a week, once every 2 weeks, or once a month. I have patients like 14 years that comes once every 2 weeks or every month, because they feel it's good for them. They know it's good, they feel good. Okay, it's good for all of us. Okay, of course, I will always tell them that that the most important thing is for them to take responsibility over their health by the maintenance with exercise, stretching, keeping a good diet, and all we know, which is good according to Chinese medicine. But if they don't have the ability, or they don't have enough I don't know how to say it. There are cases that they cannot take the responsibility and they need our help. So if they need my help, I will help them. Anyway, so what I'm trying to say basically is that on the first few treatments, I will prefer not to touch the area that hurts, because I want to see immediate change during the treatment to be able to understand that my treatment is working. So if I do my basic protocols and I work with them, and there's no change after mostly 3 treatments, I must change my protocol. I must change maybe the diagnosis is not good. So I will go deeper into diagnosis, or maybe the treatment that I did was not good enough for that time. And in these cases, I can go to abdominal. In many other cases, by the way, I will start from the beginning with abdominal acupuncture, because again, I know it works well. But we always have the doubt, maybe it's not enough, I don't know. So I might combine also some other distal points together with it. But again, when a patient comes at the beginning, sometimes there are many things, or many, I will say, many issues that we need to solve. But the most important thing is for the patient is to feel better and fast as possible. So again, to use the abdominal acupuncture in these cases, is a good way. I mentioned this earlier, patients that are afraid of needles, and if they are, again, if my main or my basic protocol will be with Jing well points and working on the tendomuscular meridians for pain issues, of course, abdominal will be much easier for them to digest in a way. So it's it's less painful, obviously. Okay, so these are the main indications. Contraindications that we might see or need to understand. So if there's acute abdominal pain without a known cause, I need to understand what's going on inside. And if my diagnosis or patient come without exact diagnosis, and my diagnosis also, I don't understand what the cause, I will not do the abdominal. Of course, I can do other treatments, obviously. Cancer in the abdomen, big no-no. I don't want to treat that. Pregnancy, also from same reason. I don't want to make any damage. If there's tendency to bleeding, it's not like, it's more to be careful. Tendency to bleeding because of blood thinning medication or any other case. It's not that it will make harm for the patient, but we don't want, we don't want so many bruises for the patients to go home with, and sometimes it can be like a big bruise. So of course, in advance, I will say it might happen, and they need to understand. And I explain it all the time before the first treatment. I explain it might happen because basically we're putting needles in the body and they go, sometimes they get, even if it's on the most superficial level, we might get bruised. Okay, I puncture face a lot with the cosmetic acupuncture. So it might happen, it doesn't happen much, but if it happens, I want the patient to be aware of that. So tendency to bleeding, here mostly it will be, Israel is very sunny, like California in a way, very sunny place. People go to the beach even till, I think, last week. Now it's December, but still beach was available and open, and it was hot enough. So if women go with, a bikini and they want to keep their abdomen clean in a way without bruises, so I will avoid maybe this method. Okay, so the treatment and the technique. So I was talking about the depth of the acupuncture. So superficial is just on the skin, just on the skin. If it's like, maybe I planned, maybe, just 1 second. I have an example that I can use this Clementine. So I will just take some needles and I will just demonstrate what is superficial. So I don't know how much you can see, but when I will get this closer, maybe I think it will be okay this way. So superficial, I'm working with this method, I'm working with tube. It's now, if you work with tubes, one of the things is that when you just press the needle, you can see that you have something like 3-4 millimeters where the needle comes out from the tube. So the superficial needling will be even more superficial than this, okay? Because we want to be only on the skin. Now the skin depends on the patient. If the patient is fat or thin, of course, the skin layer might be thicker or thinner. But basically what I will do is just I'm just putting the tube, not touching anything, and then just little puncture. Okay, that's it. There's no need in putting the needle even deeper. Sometimes the needle even will be this way. It will almost fall down. Okay, it will be very, very superficial. Again, I will do it even more superficial. I will try to find the position exactly. Okay, very superficial. Now, if I go to the medium, which goes under the skin, it means if the skin is something like 1 or 2 millimeters, I don't know I'm working with the metric system here, so I don't know the inches or the understanding, like the American understanding of anyway. So the medium will be under the skin, which is maybe 2 millimeters more deeper. So I will put it next to it. Okay. So I'm just puncturing and then I'm just pushing the needle just a bit more. Okay. Well, maybe it's too much. Just putting it a bit more. I will put it under my black shirt. Okay. So this is like the medium. And the deep, which is above the muscle or under the fat, okay? The deep will be, I'm just puncturing, and then I'm like pushing the needle a bit more until I feel it becomes a bit harder. Okay, and there I stop, because then I'm in the muscle, or I'm getting into the muscle. Okay, so these are like the 3 levels. Now, of course, it's very challenging to demonstrate it on camera, online, and not in a frontal way. But anyway, this is a way to this is my way to demonstrate it on the best option to do that. Okay, so I hope it's understood. And so this is about the depth of the acupuncture. Okay, I didn't check the questions yet. I will just finish this slide and then I will check if there are questions. Okay, so the next part is stimulation. So basically we don't need, there's no need in making stimulation, but if it's a fat patient that we want to work a bit stronger and to stimulate in a way, so we just tap the needle, just a bit, little tapping. Okay. Now, if the needle is lying, okay, if it's, oh, oops, never mind. If it's laying in this way, like this one, so I will just make a slight change on the direction of the needle. Okay, like change it to a few positions. Okay, if it's the center, okay, I will take it out, change direction and in. I don't know if you can see, but, and we can make some little movements during the treatment. So if the average treatment is between 20 to 30 minutes, so every like 10 minutes or twice during the treatment, I will come and I will make some little movements. The order of needling is starting from the deepest levels when I want to work on the elements or on the internal organs. After that, so I will start with using these needles. Then I will work on meridians, which is like the medium level. And then on the symptoms, on the most superficial way. And again, depends what we want to do in the treatment. If we just work on superficial, just on pain issues, we don't need to go too deep into the deepest levels and balancing the elements, so it will be good enough for us, okay? So, and the time, again, between, I will say 30 minutes will be better, but 20 minutes is also enough. Okay, so more indications and then I'll check questions. Possible to add points from meridians by the function. Okay, if I want to work on abdomen or on digestive system, I will combine spleen, stomach meridians or pericard meridian in order to balance the whole system. Okay, but again, it depends on what we want to do. If I want to work on the back, I can combine points on the bladder, on the legs, on the small intestine, like working on all the level or division. It's possible to add, not to add acupoints next to the main points. I will later on the examples that I have, you will see the like the main points. So for example, stomach 24 is connected to the shoulder. Okay, but the shoulder might be wide, so just this point, so stomach 24 might be good for here, but the pain is here. So I can add other points combined. It means acupoints on the abdomen, okay? That's what I mean. Possible to add electro acupuncture, recommended to treat twice a week, but again, it depends on the patient, what they can do, how many times they can come. In acute conditions, I will say 3 times a week or even every day, okay? I think when patients are able to come every day, they will be healed and cured much faster, okay? It's, that's for sure. And if they can afford it, if they have the time for it, it's better. Puncture in the same side of the problem. So if there is a facial paralysis, and I want to work on the head area on the abdomen, which is the area of stomach 12, and I want not on the midline, okay? Sorry, not stomach 12, REN 12, CV12. And I want, CV12 is working on the midline. If I want to go a bit aside, so I need to put the needles a bit on the side of CV12. Okay, so the needles will be at the same side. This is how I use it, but there are also other doctors that use it from the other side. Okay, same as balance method. You can work on either side. So you just need to try and to see what works the best for your patients. We need to pay attention that sometimes the CV, the REN-MY line is not exactly in the middle. So we need to look, we need to feel, and to find the exact location by that. Women after pregnancies, the whole abdomen is changing, in a bit. The muscles move, so we need to pay attention to that. And points on the CV channel usually will be punctured more deeply. Okay, just these indications. Okay, I will just check the chat. Okay, so let me. Okay, I'm still in the good morning, and so Lana, did you learn navel acu there as well? No, I didn't. Just the abdominal. It was in China. Sorry, I'm just going back according to the questions. I just went to observe and different clinics to observe acupuncture and herbs, and just the abdominal. So I don't use the navel. Yeah. In 2008, it was very difficult to find even that poster. I bought it for a lot of money, and then I saw it in one of the libraries there. But yeah, in 2000, I believe it wasn't there yet. Scar tissue in the abdomen from surgeries. If there are scars, I will first work on the scar. I will what's so-called open the scar, like treating surrounding the dragon for maybe 2, maximum 3 treatments. And because it might affect the whole, mostly in C-sections, when women have like a big scar in the abdomen, it will be it kind of cuts the whole flow of the meridian, mostly on the superficial level of the skin. So in my opinion, there's a need to open the scars first, and then after that, because you know what, there's another understanding for that. If the scar has a color which is kind of reddish or brown, or not the same color of the skin, it needs to be open. If the color is good, so probably it shouldn't be a problem. Okay, so if I combine abdominal acupuncture with tongue, it's possible. I do a bit tongue acupuncture. Mostly I use classical acupuncture or 5 elements or balance method. Okay, so chronic, but have good experience lowering high blood pressure with abdominal. Yeah, okay, so yeah, for sure. I mean, any other conditions, I didn't mention it because the topic today is chronic pain or pain issues, basically. But of course, I work also on other conditions, emotional conditions a lot, and it works amazing for emotional issues, tiredness, fatigue, depression, stress. I have later some examples. So mostly for pain, yes. The deepest level again. Okay, I don't know if I answered that yet, but I will, Victoria, about your question. So deepest level is all about feeling. It's very difficult to explain it, again, through the screen even more. So you must experience it. I'll go again to my Mandarin. If, Clementine, so if I'm puncturing the abdomen, now again, imagine average person, not so fat, not so thin. If you just, I'll go again, once again. I'll put this out. So if I'm just puncturing once, then I'm on the superficial or even medium level. Now I need to go to push the needle a bit deeper, but slowly. I do it slowly. And I need to feel the sensation of getting to a harder tissue. It's like, I don't know if feeling or like sensation of chi, but it's like feeling. I will try to show you how we do it. So I just puncture. Now here, I got a bit deeper. You know what? Maybe I'll just open it. Sorry, 1 second. Okay. So you can see this. I open, it's like opening the skin from the belly. So what I did is basically just punctured, I'm here. When I go a bit deeper, I hope you can see that, I feel suddenly the tissue is becoming a bit harder. And there I stop. So I just need to go under the fat layer. So again, depends. If the patient is fat, I will go deeper. Usually I use 4 centimeters of needles. It's like, I don't know, 4 centimeters, how it's in the other method of measuring. But yeah, this, and sometimes even a longer one. In cases of fat patients, I will go deeper. So this is about the deepest level, but again, I don't need to get more deep. I mean, if I feel muscle, I will pull it a bit out. Yeah, stops. Yeah, this method is not working on the muscle level. Okay, and have you ever treated PTSD kind of issues? Yeah, so again, many, so post-traumatic syndrome disorders, I treat a lot. Unfortunately, we have a lot of tension here and lots of stress with people for all kinds of reasons. So I have some examples at the end of the seminar, of the class. What about people who had surgery on REN channel? So if it's on the REN channel and the REN channel is blocked, I will go a bit to the side. It will be mostly to the kidney, and I will puncture. So if it's the scar in the midline, and instead of puncturing directly, I will go from the side and under the scar. So it will be kind of between the kidney and CV channels, but I will do it from the side, okay, not on the scar. It will not be effective. So from the side and a bit directed to the CV level. So please describe searching for the CV off center. So usually you can see when you take the measurements from CV17, CV16 to the, later I will explain how to measure. But if I see that the chest or CV17 is not in a straight line with CV12, CV8 or with the umbilicus, so then I need to find, even just to palpate, to go through the abdomen, like to feel it, to feel the same tissue, kind of. Okay, but it's possible to see, mostly if the patient is not so skinny. Okay, if they have a bit fat, we can see how the skin moves a bit. Okay, it's possible to see it. It's not that difficult, but you just need to see that you need to be in a straight line, but it might have a little curve. Okay, you can see it. Sometimes it's just very obvious. Okay, myofascial release also works on scars. Okay, yeah, good. Does the appearance of the abdomen also change as well? The appearance of the abdomen, Susan Della, I didn't really understand in which connection you asked this, the appearance of the abdomen. In which cases? If it's about the scars, it might. I mean, suddenly there's more blood flow, if this is what you meant. So it's possible to see that. Hair loss. Hair loss is also possible. I use it a lot. I will explain later on. But on the head area. Okay, soon you'll be able to see, the map exactly, and it will be easier to understand it. Rectus abdominis. Yeah. So what kind and gauss of needles do you use? It looks like you're using one soon on the screen. No, it's 4 centimeters. If someone can, I don't want to do it right now. I didn't think about the different measuring systems, but this is like, it's not 4. No, this is quite long. I don't know, 4 centimeters. If someone can check the measurements in comparison to your measurements. But I usually use Dongbang, not any promotion, just it's a Korean needle I really like to use. Very sharp, very tender. 2 inches, okay, 2 inches, 4 centimeters, okay. Okay, so again, let me see. Okay, I think I'm done with the questions. Okay, so I will continue with your permission. Okay, so, okay, 1.6 inches, 4 centimeters is 1.6 inches. I'll try to remember that. Okay, so expected results. As I mentioned, I expect immediate results, which means patient, I will, if it's the first treatment or the first meeting, and I need to decide which kind of treatment I will do, mostly with orthopedic and pain issues, I'm using like stretching. I need to see. So if it's neck, it's the easiest way to show. So if a patient comes with neck pain, so I want to understand which meridians are affected. Okay, if I want to work specifically on meridians, but also to understand how to direct, if I want to combine with the abdominal acupuncture, I want to combine also meridians. So it's important for me to know which meridian is affected. So it can be stomach, it can be a large intestine, can be a triple or small intestine, it can be bladder, gallbladder, renmai, dumai, many options, right? So I need to understand, first of all, so I will check maybe this one and this one and this one and this one. According to this, I understand which meridian is affected, and I will treat with the meridian system. But if they lay on the back, and I will ask them, so if it's difficult to move the head to the side, they can do that on the bed also when they lay on the bed. Okay, so I will ask them to do that before I puncture and to tell me how strong the pain is, 1 to 10, or where exactly they feel it, in which area. Then I will do the puncturing and I will tell them immediately, okay, do it once again. Let me see if something changed. If it didn't change, I need to change my treatment in a way. So I will expect during the treatment to see a difference. Many times they will come after that meeting and they will say, in most of the cases, they say, yeah, I felt better. Okay, it was good for 1, 2, 3, 4, 5 days. I don't know if I see them once a week in average. So I will expect the changes then. If there's no change, I need to check the location while I'm puncturing, yes? To check the location once again and to check the depth. So I will take again the measurements of how I located the points, and I will do that once again. About the depth, I will see, I will take it a bit out and a bit in, I will change directions, maybe I will add a few more. Usually if I put a needle, I will not take it out, I will add to that more, okay? Because the effect might be stronger and wider in a way. If the condition becomes worse, it happens not so much, but if it becomes worse, I will pull the needle out and check again the position. Okay, if it still continues, I will pull it out and continue with other method maybe. Okay. So any questions so far? Let me see. Okay, good. So now I will start with abdominal meridians. So this, I wish we could see these kind of abdomens in the practice, but it's the easiest way to demonstrate the different positions. And here we go. So we have the different meridians. We have the CV, the conception vessel. And I will not go to point location now, okay? I believe you all know how to find different points, but some main points that we need to understand are CV17, which is in the middle between the nipples, okay, in that level, and CV16, which from there we start measuring the points. Now, I don't know if you had it in your studies, but at the beginning we had like a measurement, like a meter, kind of meter that measures all zones all over the body. So if you have difficulties in finding these points on the abdomen, you can use that. I hope you know what I'm talking about. Okay, it's like a rubber with some the zones on it, like the measurements of one zone, and you can do even half a zone, and you just take all the measurements. So we need to see that between CV8, like you feel I do it by hands. So I put my little finger on the area of CV16, and I measure with the other finger till I get to the middle. Like I mean, the other little finger is in CV8, so one on 16, one on 8, and then I need to find the middle. Okay, so just I hope this is okay. So CV8, CV16, and then the two fingers, and then I just need to find that I'm exactly in the middle. With this, I point CV12. Okay, and just few words maybe on the points while I'm talking about them. You know what? First, I will just show all the meridians, and then I will talk about specific points and their indications. So this is the CV. We need to pay attention. CV16, CV12, CV8, CV6, and CV4 are also important points for us. CV6 will be on the first belly that we feel. We all have them. Maybe this guy, this model, maybe he doesn't have it much, but still we can feel it. Okay, we just go, we slide the finger from the navel to the first belly. And then the second belly is CV4. Then we have the kidney channel that is half a tune from the center, from CV. Important points that we have later on, I will talk, okay? We have the stomach, which is 2 tunes from the CV. And 2 tunes, it means that it's on the highest area of the muscle, okay, of the six-pack, yes? Okay, so this is stomach channel. Now here in this specific picture, sorry, it's not equal. So I changed the positions a bit because he's a bit turned out to the side. Okay, so all the points are a bit on the left side, are a bit down. Then we have the spleen, which is 4 tunes from the center. And 4 tunes from the center, we need to feel the end of the muscle, okay, where it ends. So again, I slide from the highest level of the muscle, and I slide all the way until I feel it ends. So it's like, you know what, I will demonstrate on this. So if this is the highest point where stomach channel is, I will feel up until I fall down, yeah? Until I fall down, and this is the spleen line. Then we have also the liver with only 2 points on the abdominal area. We have on the lower part, but we have liver 13 and 14, and we have gallbladder, which is on the sides even more, not so useful in our acupuncture, but still we need to be aware of these points.